Hi, and welcome to the Muscle and Joint Podcast. Thank you for listening. My name is Dr. Malik. Today's article is titled, Can Long COVID Affect Your Muscles and Joints? So, long COVID is an umbrella term used to describe both the acute COVID-19 infection and also any post-COVID-19 symptoms that last longer than 4 weeks. These symptoms are not explained by an alternative diagnosis, so they're given the term long COVID symptoms. Just like the infectious period of COVID-19, the signs and symptoms of long COVID are on a spectrum, ranging from a mild residual cough to more severe symptoms like difficulty breathing, shortness of breath, and nerve or muscle damage. On this spectrum, up to 65% of patients may experience muscle and joint-related symptoms. Some of these symptoms can include myalgia or muscle pain and arthralgia or joint pain. Some trends emerging in recent studies demonstrate that certain groups might be more susceptible to muscle and joint pain after having COVID-19, including females, older individuals, those who have a higher body mass index, or have myalgia upon hospital admission for COVID-19. Also included in this list are people with co-morbidities and individuals who have reduced physical or functional state prior to being infected. Other studies have reported reduced muscle strength, chronic fatigue syndromes, and in severe cases, the progressive breakdown of muscle fibers. If you are feeling residual muscle or joint pain after having COVID-19, a chiropractor can help find ways to alleviate your symptoms. Here's how. Chiropractors are trained to investigate potential causes of your MSK symptoms and more specifically determining the best course of treatment. Research shows forms of manual and soft tissue therapies are effective in targeting blood flow to areas of injury and to help promote healing, as well as relieving joint pressure and resetting pain receptors. Usually one or more of these hands-on approaches used by chiropractors results in pain relief regardless of the cause. Chiropractors are also well-versed in implementing a variety of treatments, including modalities such as TENS machines, interferential current, shockwave, or low-level light therapies, and other treatments. In treating long COVID symptoms, some clinical considerations would also be given to the type, frequency, and manner in which the chiropractor conducts supervised or at-home physical therapy. For example, following a thorough history and physical exam, a chiropractor may create a treatment plan that includes a combination of manual therapies as well as rehab exercises, depending on the individual needs of each patient. However, a patient suffering from long COVID-related muscle and joint pain may be advised to perform less strenuous rehab movements to ensure their muscle and joint pain can adapt and heal effectively. In some cases, additional measures such as use of pulse oximeter to monitor one's oxygen levels during exercise may be required. Beyond physical activity rehab and pain management, chiropractors can also advise patients on ways to conserve energy when performing their daily activities or physical therapy exercises. Similarly, ergonomic strategies may be recommended at the workplace or at home to facilitate essential daily tasks. As part of a healthcare team, visiting a chiropractor can also become a follow-up point of contact where the patient's progress can be monitored or referrals can be made appropriately when needed. If you continue to feel muscle and joint pain after experiencing COVID, book an appointment with our chiropractor to discuss treatment options that will help alleviate your pain. We can be reached at 905-593-1605. Thank you for listening to our podcast. If you have any questions or comments, please send us an email. We can be reached at clinic@muscleandjoint.ca. Thank you and take care.